good to go. Well, good morning, Queensland, and it is wonderful to follow on from the Premier, who has been announcing some exciting initiatives and investment, and it's great that we can talk about supporting jobs, growing industry, looking after our environment, because we are doing so well in our response to COVID. Our economy is continuing to grow. As the Premier has already reported today, 0 new community cases, which is fantastic again. We have 1 new case overseas acquired and in hotel quarantine. That puts us at 33 active cases currently. We had 6,825 tests yesterday and 21,712 vaccinations. That puts us over 5.2 million doses have been provided already in Queensland, both by Queensland Health as well as our wonderful GPs and community pharmacies. Now, our current figures are reported as 69.98% and 52.25%, but of course the Commonwealth don't report on weekends, so when we get that update today from the Commonwealth, we are absolutely confident we're going to see that 70% figure appearing in those results. So thank you to everyone who came out on the weekend, especially at our schools. We had 18 high schools in some of our low vaccination areas, and we're still getting some figures through, but we are absolutely confident that we did over 4,000 vaccinations in those 18 high schools. So well done to the communities, to the families, to all of our health workers and volunteers who manned those schools on the weekend. It was great to see sausage sizzles happening and fundraising for those schools as well. There is 1 positive case reported by New South Wales that has travelled into Queensland and was required to hotel quarantine and was turned back around. During that time they were tested in Queensland and were found to be positive. So there's no risk to the community here. However, the airport itself is an exposure site around that gate, and of course people who are on that flight back to Melbourne, as I understand. So Dr. Young and the Deputy Commissioner can talk about that. Was that Sydney, was it? Sydney, sorry, not Melbourne, Sydney. Can talk a bit more about that in a moment. I also want to say how great it is that people are now coming home to Queensland and going into home quarantine as part of our trial. 274 people are already approved to come home this week, and we hope those numbers will grow. We have reached out to many people, around 2,000 people who were seeking to return back to Queensland, to offer them this opportunity. So for people interstate, please be checking your emails, making sure you're responding to these offers, and for other people who haven't been offered one yet, please make sure you're looking at that criteria and seeing whether you are eligible. The best thing you can do if you are a Queensland wanting to return is get yourself vaccinated as quickly as possible. And that is the key here. You know, we will keep testing, people will keep coming forward with any symptoms, we will keep socially distancing and wearing our masks, but the key out of all of this is our vaccinations. Time is up. No more waiting. We need you to get vaccinated now. It will take 5 to 6 weeks to get full cover. So we want you getting vaccinated today. Go to a local community pharmacy, our GPs, or one of the many Queensland Health vaccination centres to get your jab today. If you are 12 and older, do not wait. We want to make sure that our community is safe and that we can fully open up our community as quickly as possible, and we can only do that with very high vaccination rates. I'll hand over to Dr. Young now, and then we'll hear from the Deputy Commissioner.
Thank you, Minister. So no new community cases here in Queensland today, which is excellent. We're still seeing good testing rates, so thank you very much for every single person who comes forward and gets tested. That remains critical, more so than ever, because we know we can get cases pop up at any time. So we did have 1 case that came into Queensland while infectious. They arrived on VA 917 into Brisbane Airport on Friday. They didn't have the right border pass, so police managed them and they went into hotel quarantine overnight, the Novotel at Brisbane Airport, and then the next morning returned to Sydney on Qantas Flight 509 at 7:50 a.m. So we're asking people who are at that departure gate and in that part of the airport to come forward and get tested. So that's important. But we do know, of course, that our airports are always higher risk, and that's why we require everyone in airports to wear a mask at all times unless they're seated and eating or drinking. But that's really important because we know that we'll see this going forward. So a great weekend. 18 schools were open vaccinating and did over 4,000 vaccines, which is fantastic. So we'll be reviewing that process today to see if that's been helpful for those communities and looking at expanding the numbers of schools involved in that program going forward. There are so many places you can get vaccinated in Queensland today. There are pharmacies. I saw one when I was in Rockhampton who'd done an enormous job getting people vaccinated. Similarly in Mackay. So pharmacies are a great place to go and get Moderna. Then there are GPs that are, of course, offering Pfizer. Then Queensland Health facilities are offering Pfizer. So there's many options. It's really important though that you get vaccinated today because you'll need your second vaccine 3 weeks later for Pfizer, 4 weeks later for Moderna, and then it takes another 2 weeks after that to be fully covered, fully protected. And that's also what's required of people who want to come back into Queensland and have that opportunity to quarantine in their own home. They need to be fully vaccinated. So if there's any Queenslander out there in any of the hotspots in Victoria, New South Wales or the ACT, go straight away if you haven't already and get yourself vaccinated, because that will delay that opportunity for you to come back. Thank you.
Morning. Just on our compliance activities, yesterday 8,032 vehicles intercepted at our borders, 100 refused entry, 7 persons into quarantine and 2 penalty infringement notices issued for people still trying to get through without the appropriate passes. In relation to masks, we handed out 55, so the reminder is there for everyone again, and I'll say it again and again, please make sure you carry and wear your masks when you should, although happily we did not have to issue any penalty infringement notices. And just a thank you to our businesses. We're continually checking businesses every day, even though I haven't spoken about that recently. For instance, yesterday 37 were checked and all were compliant. We've seen no non-compliance from our businesses in the last month or so, so very good work going on there, and please continue that. In relation to the person that was turned around on Friday, that's just an endorsement of how the system works. So people that are coming into our state, if you do not have the appropriate border pass, that will be picked up. Our officers picked that up. That person was placed into interim hotel quarantine and returned the next day, as you heard. We're still reviewing that. The officers were deemed as close contacts, so they're in quarantine. We'll review whether any enforcement action needs to be taken and make a decision on that in the short term. With respect to the home quarantine trial that starts today, so that system is in play. There are 2 aspects. One are persons who can get exemptions through Queensland Health, and my understanding is Queensland Health have gone through 500 invitations there or thereabouts. And from the Queensland Police Service Border Pass team that are looking at returning Queenslanders, over the weekend 2,000 invitations were issued and 407 were responded to. That then ultimately resulted in 225 applications being approved and 261 persons being issued with border passes. And they are arriving in a consecutive manner across the week. They're constrained by their ability to get flights and come in, so obviously as more flights come out of the hotspots we may see some increases there. The message, as the Minister alluded to there, is people have to make sure that they, one, meet the criteria. We have no discretion in that. If they do not meet the conditions of the class exemption issued by the Chief Health Officer, they will not be issued with the border pass. They must meet those conditions. They need to respond to our invitation. As you've heard, there were a number that did not, so please do monitor that and get back to us because there are constraints around the time they have available to travel. Other than that, we'll continue to monitor that and see how it's going. Thank you.
Did that person at the airport spend time on their border pass, or they just have the wrong paperwork?
No, that's the issue that I alluded to that we're going to have a look at and review, because I said the officers involved aren't able to do anything about that at the moment. They're a bit tied up in quarantine. So we'll review that and just see whether anything needs to happen. On a number of occasions, we've turned people around simply because they've got it wrong and take no action. Generally speaking, we would only take enforcement action for those that deliberately try to deceive the system.
Can you just explain the home quarantine process? How do people get safely from the airport to their home?
That's part of the conditions, and it's very similar to what we've done with our hotel quarantine arrangements, where we have approved methods of transport, be they government-provided buses or taxi services that are approved for that. So people need to meet those conditions, otherwise they can't take part of the trial.
What's the average waiting time now for a border pass application to be processed?
That's going to change. There is no particular average waiting time. We cannot discriminate for those that are returning Queenslanders. The only way you can get prioritised through the system is to have an exemption that is provided by health against the 14 odd categories that people can apply for exemptions. If you don't meet one of those and don't have an exemption, you go into the border pass system to apply as either a returning Queenslander, which can now be either as hotel quarantine or home quarantine for the trial, or as a relocating Queensland resident, which is under the hotel quarantine approach. For those people, it is chronological. So it goes back to the 5th of September when people applied, and we're trying to clear that backlog. Now, the numbers that can be processed will change depending on how many people go into home quarantine. Bearing in mind that people that do not meet the home quarantine requirements will still be able to be considered for hotel quarantine on a chronological basis.
As you said, we've still got police at quarantine hotels, and will there be dedicated police checking on people at home quarantine, and does that take a strain on the force?
Look, we've done home quarantine checking all the way through. There is an electronic system where people will get messages daily. They have to respond to that. There is a triaging of that to make sure that people are compliant. The vast majority of people are compliant. If there's any concerns in relation to those persons' responses, that's then referred to the police service. And we have the capacity to deal with that at the moment.
Who controls the home quarantine app? Who surveils that? Is it the police or is it Queensland Health?
That was set up through the Department of Justice and Attorney General. I understand the monitoring system is SSQ, Smart Services Queensland. So it's done through Smart Services Queensland.
Just a clarification with that case at the airport. Did the person test positive and then was put on a plane? Or
No, my understanding is they were tested and the result came back after they returned.
why were they put on a plane with other people when they hadn't received positive? Or
We have people tested every day, as you know, many thousands of people. We apply the normal standards around that. So everyone that travels on a plane must wear masks. So all that would have been in place in terms of that person's return.
this might be a question for Dr. Young, but about the home quarantine system, is there any chance that people may be able to come in via road over the next couple of weeks? What will be the...
Not during the trial. So we're doing this trial and then we'll review it and make changes depending on what we find.
How long is the trial for?
For 1,000 people,
And for the 2 weeks, for 1,000 people?
that's the aim, but we'll keep on going depending how long it takes to get 1,000 people. But we'll be reviewing the trial as we go through. We won't wait till we're finished.
So when can we expect to know those changes?
Well, this is day one. Let's get through day one and get through the next week and see how this goes.
Do the 1,000 people need to arrive in Queensland in a set time frame?
Yes, at the moment that's what we've offered them.
So between October 11 and October 18?
Yeah, so 2 weeks.
Okay.
Just on our vaccination rates, we know they are getting better, but there's still large pockets of the state that are well below. Are you considering any changes to the vaccine rollout to get more people in? Is there anything
Yep.
we can do to get more people, or
Yep.
they just...
So I think the weekend, using 18 schools, we had really good uptake there. So I think we'll be looking at increasing the numbers of schools in that school program. And then really it's just getting the message out that people can't wait. So having gone through Mackay and Rockhampton over the end of last week, I could see that there are a lot of people thinking this hasn't impacted on them. I was out there, no one's wearing masks there because there's no requirement to. It's a long time since they've had any cases. So I can see why people were a bit complacent. So it's really about getting the message out that soon we will see virus throughout our state.
Given that New South Wales has reopened today and can now travel into regional areas, are you concerned that that's edging ever closer, that we will see more cases around that border area?
Yes, so we're keeping a very, very close eye on what's happening in the border.
Dr. Young, economists at Deloitte have recommended Queensland enact wider jab mandates to drive up, vaccination instead of relying on goodwill. Will or is Queensland considering, having compulsory jabs for workers in sectors like childcare, in education, for journalists, for example?
At this stage, we want mandatory vaccination in those vulnerable settings. So when you've got people who are particularly vulnerable and who can't necessarily be fully vaccinated themselves, we know that people having cancer treatments, for instance, the vaccine's not effective, they're so immunosuppressed. So where we've got very vulnerable people in Queensland, we've mandated vaccination. So that's in our hospitals, in our aged care. We're looking at disability care. And we've certainly pushed it out through our prisons. So that's my absolute priority at the moment. It's where people are vulnerable. Outside of those settings, people can make choices about the vaccine. So they can decide what risk level they're going to have. Whereas I don't think they can decide when they go into one of those vulnerable settings. So at the moment, there's an absolute focus on vulnerable settings.
Children under 12, for example, can't get vaccinated for the simple purpose that there is no vaccine for them yet. So shouldn't people working with kids who can't get vaccinated also be made to get the jab?
Right. Children to date have fortunately had mild disease. So at this stage there isn't a vaccine that's been endorsed by the TGA here in Australia for children under 12. That will come. So once that's available, then we'll work with it. But at this stage, there isn't a vaccine that's been endorsed. So for those children, it's important that parents again think about what their risks are for that group.
But I guess kids can still spread COVID. If you've got a younger child, perhaps you've got a child in primary school and you can pass it on, and that's how you would get, a wider cluster. So if early learning teachers were vaccinated, wouldn't that then protect from wider spread? Because the spread it with.
But those early learning teachers were prioritised in Queensland very early on. So they've all had the opportunity to protect themselves by being vaccinated. And if there are any who aren't vaccinated today, I strongly recommend that they, to protect themselves, go and get vaccinated. That's important. And then people who live in households with young children, you're very right. Those young children could bring it into the household. So any household with young children, my advice to you is for everyone else in that household who's 12 years of age or older to get vaccinated. That's really important. So if your younger child who can't be vaccinated today gets infected, then if they spread it, the risk is very low to that family.
A question for you, perhaps the Minister. Has Queensland commissioned its own modelling? Tasmania, for example, called in the Burnett Institute to do state-specific modelling to complement the Doherty modelling. Have we commissioned anything like that?
We do internal modelling, of course, at all times. We've been doing that right from the start of the pandemic to work out what the impact on our hospitals would be, to work out what capacity we need. Then we've done modelling on vaccinations, for instance, to work out how many clinics we needed, where they need to be. So we do that sort of operational internal modelling at all times.
What does that operational internal modelling say about the capacity of our hospitals to deal with opening up, if we were to, at 80% vaccination?
It shows that we would be stretched. Of course we would be, which is why I don't want to stop at 80%. I would like to see every single Queenslander 12 years of age or older vaccinated. I think that's absolutely critical. The more Queenslanders who are vaccinated, the less the impact will be on our health system.
What that happens is that 90 or 95, because there's been a lot of commentary that people need sort of a goal to work towards,
right,
and we don't know what that number is.
Well,
how long it is.
Well, I believe in Queensland we should be aiming for 95%. We have more than 95% of our children fully vaccinated. I believe our adults can do every bit as well as our kids. So that is just what I would like to see. We, of course, are doing all of the work with the 70 and the 80% thresholds that have been set by National Cabinet, and we're looking at all of that. But if you're asking me as the Chief Health Officer what I would like to see, I would like to see our adults at the same level as our kids are.
Is that your advice then for reopening the borders?
No, it's not my advice for anything. It's just what you said. What target would I like Queenslanders to aim for? I would like Queenslanders to aim for the same target that we have for our children. That's what I'd like to see. It's nothing to do with borders or restrictions. It's purely where I'd like people to aim.
Is there any modelling then on when we might reach 95%?
Well, it actually depends on Queenslanders. We've got more than enough vaccine that we could reach that at any stage. It's people coming forward. So at the moment we're still seeing people each day coming forward and getting vaccinated. It's about whether people increase, which I'd like, increase that rate of coming forward, and that's why we're aiming to open up more schools where we think that will make a difference.
Do you think it would be helpful for that internal and operational kind of modelling to be released to the public so that they can get a sense of what is likely to happen if they don't take up a vaccine now that it's available?
We've actually only had enough vaccine for quite a short period, so I don't think that would be useful. I think we need to make the vaccine easily, rapidly available to everyone before we start worrying about what those consequences might be. So yes, of course we've done the modelling because we need to be prepared, but I would hope that we don't need it. I would hope that we will see that continued increase in vaccination rates. There are a lot of parts of Sydney that are over 95% vaccinated now, so I think we will achieve that.
Last question. We're seeing cases down below 500 in New South Wales now. They've opened up overnight or released their lockdown overnight. Victoria's still up over 1,500. Are we likely to see a situation where travel restrictions are eased on New South Wales before they are with Victoria?
It just depends on what happens. So over 500 cases a day is still a lot of cases. So we just have to see what happens there and see whether it's widespread or whether they have localised areas of cases. So as we've done before, I mean, we were moving towards a process of only locking down to certain LGAs, but then because of that widespread Delta transmission, we had to go back to whole states. But if it can be brought under control in certain LGAs, then of course we look at the potential of only being locked to smaller areas.
Very quickly, I have to get to Cabinet.
So even jurisdictions like the Northern Territory, which are COVID-free, have announced roadmaps based on vaccination milestones. Why hasn't Queensland done so, I guess, in a way that human beings in general just like to work towards a goal and be rewarded in that way?
Sure, and you know, we have to remember that the rewards in Queensland is actually retaining what we've got, because we have already got some of the lowest restrictions. So other than removing masks, and domestic borders, we have very little restrictions happening in Queensland, and that's what we're seeing when we travel around the regions, is that the regions just haven't seen any outbreak, and so there's a fair bit of complacency and a view that people can wait. The task here is everyone taking on the responsibility for themselves. The quicker you get vaccinated, the quicker you have protection. You know, we can talk about targets of 70-80% for the state, but that doesn't mean that you are protected. If you are not vaccinated, then it doesn't matter if we hit the 80% target. You are not protected. This virus will go into every single community once Queensland opens up and once Australia opens up. So it's not if or maybe, it is when. It will absolutely go into every community. The question is, who's going to get this virus? It's going to be those people who aren't vaccinated. So if you want to target, the target is, we don't want to get to 400 deaths that we have seen in less than 4 months in New South Wales. Over 60,000 cases. Now we've had, I think it's 4 cases in the last couple of weeks of people travelling from interstate who has brought the virus with them. So the risk is very, very real, and we need to make sure that everyone's getting vaccinated. Now, we'll work on the national plan, and the Premier will keep talking with her interstate colleagues, and the Chief Health Officers will discuss those risks and what we can do to open up more. But if someone wants a target, the target is getting yourself protected in the next 5 to 6 weeks. That is your mission. Get yourself protected, and that helps protect our whole community and allows us to open up. Now, I do need to get off to Cabinet.
Back at 95% though.
Oh, I would love to see us get at the highest rate possible. You know, when we talk about our health system is still going to feel pressure, just like it does with flu season every year. When we have COVID throughout our communities, that will put an impact on the health system. So as individuals, we can control how much of an impact it has on our local hospitals, because it won't be contained to 5 COVID hospitals in Brisbane. It will be every regional and local hospital if you have local cases. So I want as many people as possible to come out and get vaccinated. If we can vaccinate 95% of our kids, then why as adults can we not achieve the same target? Of course we can. So let's get vaccinated as quickly as possible and go well beyond that 80% target and make sure that we're keeping everyone safe. Thanks everyone. Really got to get to Cabinet.
Need to be vaccinated before we can let the thousands of Queenslanders stuck outside our borders come back home. What population of Queenslanders will need to be vaccinated before Queenslanders stuck outside?
Well, we're working through that. We've got a trial. Let's work through this trial. It's day one, as Dr. Young said. Day one, we're offering up to 1,000 Queensland residents to return and home quarantine. I want Queensland residents to take up this opportunity. We want to see the home quarantine trial go well. Everyone needs to comply while they're at home, of course, but I'm just thrilled that there's people already coming back today and are already on their way home to home quarantine. And I'm very confident Queenslanders will do the right thing and this trial will be a success. Thank you.